Hello, my name is Christine Roman, and welcome to Roman on CVI. I am launching this new adventure in an attempt to really provide some thoughts, answer some questions, maybe give some examples, possibly clarify um, issues related to my work and to the greater topic of CVI. As I sit here, I realize that most of you have only seen me wearing black clothing. I can't wear red plaid when I'm working with students with CVI, and I assume all of you know why. I'm in my home right now, and I'm taking this opportunity um, to really speak for myself and to um, provide these thoughts as they occur to me or as others prompt me to discuss them. I've had a long and really interesting career. I started out as a teacher of the visually impaired and worked in the public schools for 17 years. In that job, I had students on my caseload from birth to 21 years of age. I worked in separate settings where children were in special schools, and I worked in public schools. I worked with children who had gifted abilities and children with significant and multiple challenges. All of that really brought me to the place where I realized profoundly that I was prepared to meet the needs of those children who had ocular disorders. But when asked about students in a classroom whose eye exams were fairly normal, but who clearly did not see normally, I was very stumped. Thus began my big journey. I haven't stopped. And that has been one of, I think, the most driving forces in my professional life is to understand and better serve children with CVI. I've also become involved with and deeply respect many of the families whose children I serve. These families are seeking the input of providers who have competence in this area, who know CVI with depth and breadth, and who also have a passion for their child. They're hoping, I believe, that even if the provider does not have all of the content, that they will have the drive to find out and that they will never give up on helping their child become all they can be. It is really because of families that I do this work. It's quite simple. I always say this is kind of my mantra, but I think about if I were in their position and what I might want. And I know I would want somebody who never gave up and who taught with their head and their heart. So I'm going to begin this interesting journey. We'll see where it takes us, and I hope that that you will find the content interesting. I welcome people to respond to me by email if they want to, if they have things they want me to talk about further, or if they have questions about things that I do say. I am not here to speak a truth. I am here to give you my point of view on CVI. Many of you know my work, and my work is really centered around an assessment that I developed called the CVI range. The CVI range is a functional vision evaluation that is replacement for the FVA used for children with ocular disorders. It is based on the principles associated with the characteristics of CVI and obtains a score on a 0 to 10 continuum. That score is used to determine the type of interventions and the kinds of adaptations needed for that individual student. The CVI range can work with any kind of student. It's not just for children who are very young or children with complex needs, because it looks at the characteristics and not the development of the child in other ways. It's useful for all children. So I should say up front that the content that I will discuss or the examples that I provide will all be centered on that work. I have to also say that over the years I have become more convinced, not less, of the efficacy and importance of the CVI range. This is not to say that other evaluation measures are inappropriate. Anyone who knows my work knows I certainly don't propose that, but rather to say that um, that that interventions for children with CVI just don't seem to work if they're based on some random guess or something that you happen to see someone else do in some circumstance, or a principle that is not precisely driven by a child's exact visual needs. Um, I also would like to say um, that in the beginning of my career, I could find almost no one else to talk to about CVI. And now, many years later, and 3 books later, I'm delighted that there are so many others who are interested in this topic. They may come at it from different angles, but I think we should all keep an open mind to everyone's approach and use what's best for your child. Um, with this change, this positive change, also comes, strangely, some conflict and even some criticism. I am not here to address that. I'm here to provide some information and some content and some examples that I hope are useful in real life to your children or your students. I look forward to our conversations going forward. Thank you.